November was by far the worst month for the pandemic in Montana. 29,000 cases were reported, and more than 300 Montanans died from COVID complications. MTN's John Riley spoke with the state about what is driving the spread and how the pandemic compares to other public health crises.
320. That's the number of Montanans that died during the month of November as a result of COVID-19. DPHHS says right now there's significant community spread across the state.
The pandemic has certainly picked up steam. We're in what we're calling nationwide, our third wave, and there's a high prevalence of COVID-19 in communities across the state.
The first COVID-19 death in Montana was reported on March 26th. 4 months later, at the beginning of July, the state was at 22 deaths. By August 1st, there were 61 COVID deaths. By September, 106, 181 by October, and 397 by November. At the beginning of December, Montana has lost 717 people to COVID-19. Preliminary data from DPHHS shows 95% of COVID deaths are happening in individuals over the age of 50 years old. 2/3 had an underlying health factor like diabetes or heart disease. Common conditions in Montana.
We estimate that about 57% of Montana adults have one or more chronic condition that they are actively managing.
Officials have been following CDC guidelines for attributing a death to COVID-19. The virus has to be an attributing factor in order for it to be considered a COVID death. A COVID patient that died in a car crash would not be counted as a COVID death.
Ultimately, an individual might die of pneumonia, but it's COVID-19 induced pneumonia.
DPHHS warns that at this rate, COVID will be at least the fourth leading cause of death in the state for 2020, and has already surpassed traffic fatalities, of which there have been 186, and suicides, which preliminary reports indicate 231 Montanans have died from through October 10th. A big concern right now for many Montana hospitals is that we'll see another spike in COVID cases in the weeks following Thanksgiving. December very well may be worse than November, with more cases, more hospitalizations, and more deaths. Reporting in Helena, John Riley, MTN News.
And that death toll from COVID-19 in Montana has now risen to 733. 16 people have died since Monday, including 4 more in Lewis and Clark County, bringing the county total to 16. Jefferson County has also recorded its first death. We want to remind you that MTN uses a composite of state and locally reported data. Local county health departments may be alerted to cases before Montana DPHHS. Using that local data means there will be times when MTN coronavirus data does not align with the state report.